Hello, ladies and gentlemen, sisters and brothers, gender neutral and gender fluid. My name is Yvonne Weldon. I am a Wiradjuri woman from Cowra here in New South Wales. I'm from the waters of the Clare, which later became known as the Lachlan, and of the Murrumbidgee Rivers. I am elected Deputy Chairperson of the Metropolitan Local Aboriginal Land Council by the Culture Authority under the Aboriginal Land Rights Act for the land I am on. I would like to pay my respects to all elders past and present, to all First Nations, to you and the ancestors' lands that you are on. My people have practiced our traditions for thousands of years and endless generations. One tradition that is shared in various forms across Australia is a welcome to country. It is more than just words or something you tick off on. It is a spiritual process. By honouring the ancestors' footsteps, we are all walking in. Continuing the practice of the many generations before us to the many generations to come, where the sharing and the trading of our resources, our knowledge and our traditions has been my people's way of life since time began. Traded and shared amongst the nations, the tribes and the clans that have existed here for over 65,000 years. We traded for necessity and not for empires. The boundaries of our traditional owners are written into the earth's natural landscapes. The boundaries of the Eora are the Hawkes River in the north, the Nepean in the west, and the Georges River in the south. On behalf of the Metropolitan Local Aboriginal Land Council, the elders and the members, I welcome everyone to the land of the Gadigal. I acknowledge the Gadigal people and also the people's lands that you are on, whose spirits and ancestors will always remain with these lands, our Mother Earth. As we're gathered online, let us all remember and acknowledge the many sacrifices that have been made along the way, the ones we'll continue to make, and those we shouldn't have to. Our songlines and our customs have sustained us, and they are embedded into the core of this nation. My people are the oldest living culture of the world. And as we are gathered online and in person, reflection and remembering is important. The challenges that we're all faced with today is not the same as it was only a few years ago, or even in the last year or so. These challenges can bring a disadvantage that flows on from one generation to the next. It will never change if we don't take stock now to recognise, respond and support with real tangible investment in our society, for the people and with the people. As you connect, learn and share today, tomorrow and beyond, share what you know and your learnings so you can make a difference to the lives of so many, because there is always someone else worse off than you realise. Your commitment to each other can change the pathway for so many. So let us all draw upon my people's spirits as we continue on our journey. May my people's spirits walk with you and guide you as we strive forward for us all. Again, on behalf of the Metropolitan Local Aboriginal Land Council, welcome to Gadigal land. This always was, always will be Aboriginal land. Thank you and have a wonderful day.
Welcome to the National Medicine Symposium 2023. I'm your host, Tegan Taylor, journalist and broadcaster, and it's my privilege to be here today as we delve into the critical issues facing our healthcare industry. In Australia, healthcare contributes close to 7% of our nation's greenhouse gases, with medicines being one of the largest contributors. Pharmaceutical waste throughout the global supply chain has led to environmental, human and animal toxicities, and in the case of antibiotic residues, to antimicrobial resistance. Delivering environmentally sustainable and adaptable health services is critical for all sectors and an important national priority. Incorporating sustainable practices in healthcare settings, including the appropriate use of medicines, can improve the safety and quality of care, improve the health of the community, reduce low-value care, unwanted variation, and reduce waste. Today, you'll hear from experts, healthcare professionals, policymakers, and thought leaders from around the world as we discuss emerging and key issues around sustainability and the quality use of medicines. We'll explore innovative practices and initiatives driving positive change, hopefully inspiring you to continue to consider how these apply to your healthcare setting. Together, we'll drive positive change in healthcare, making it not only more effective, but also environmentally responsible. So thank you for being here today. Now, unfortunately, the Minister for Health and Aged Care, the Honourable Mark Butler, isn't able to join us today, but we have Senator the Honourable Malarndirri McCarthy, Assistant Minister for Indigenous Health and Assistant Minister for Indigenous Australians, who will provide the opening address. Welcome, Minister.
Hello, it's Senator Malarndirri McCarthy here, Assistant Minister for Indigenous Australians and Indigenous Health. It is my great honour to welcome you to the 2023 National Medicine Symposium, hosted for the first time by the Australian Commission on Safety and Quality in Healthcare. Before I begin, I would like to acknowledge the traditional custodians of the lands on which you are gathered today, the Wurundjeri and Woiwurrunga and Bunurong peoples of the Kulin Nation. I pay respect to First Nations elders, both past and present, and extend that to all First Nations people taking part today. I'm filming this in Canberra, on the lands of the Ngunnawal and Ngambri people. Today we are bringing together leaders from across the health sector to discuss and debate critical issues around the sustainable use of medicines. Many of you would already know the importance of incorporating sustainable practices in healthcare settings, including the appropriate use of medicines. But we also know that in Australia, medicines are the third largest contributor to the total greenhouse gas emissions produced by our healthcare system. And we know from the Atlas of Healthcare Variation that we can do better. Delivering environmentally sustainable and adaptable health services is an important national priority. The focus of today's symposium, Sustainability in Medicines, Good for People, Good for the Planet, gives us the opportunity to reflect on how we can shape our healthcare system now and into the future. I'd like to put forward 3 important strategies to start the discussion today, and I look forward to hearing many more from you. Firstly, we need to become leaders in medication stewardship and ensure safe medication practices for vulnerable groups. Without medication stewardship, we risk increased levels of chronic disease, antimicrobial resistance, inappropriate use of medicines, and medication-related harm, and we will contribute to the increasing levels of greenhouse gases and the impact of these on people and our planet. The Australian Government Department of Health and Aged Care is currently developing Australia's first National Health and Climate Strategy, and medication stewardship will be a focus. Antimicrobial resistance continues to be one of the most significant challenges for healthcare services in Australia and worldwide. Later this year, the Australian Commission on Safety and Quality in Healthcare will release the 5th Australian report on antimicrobial use and resistance. Secondly, we must embrace the digital future. This is particularly important at the points where patients transition from one place of care to another. Australia is a signatory to the 3rd World Health Organization Global Patient Safety Challenge, Medication Without Harm. This challenge aims to reduce severe, avoidable medication-related harm by 50% globally over the 5 years to June 2024. By embracing better digital technology, we can better communicate ongoing care needs for the 90% of people who experience a change to their medicines while in hospital and reduce hospital admissions that are medication-related. We can use digital technology better to reduce duplication and waste through virtual consultations, real-time prescription monitoring, electronic discharge summaries, prescribing and medication charts, and using My Health Record. By using the technology we have, we can also improve the overall sustainability of medicines. The third strategy is to improve the information we provide to consumers. Engaging in shared decision-making when establishing treatment goals provides an opportunity to avoid inappropriate or unnecessary medicines-based solutions. The Partnering with Consumers standard within the National Safety and Quality Health Service standards requires systems to be based on partnering with patients in their own care in order to support the delivery of care. Patients are partners in their own care to the extent that they choose to be. When medicines are needed, we should provide information in a way that meets the needs of all consumers, and this information should be easy to understand and use and be provided for ongoing care on initiation, including on discharge from hospital. I challenge you to facilitate the exchange of knowledge, ideas, and best practice amongst attendees. I hope that this symposium facilitates partnerships and lays the groundwork for ongoing collaboration to drive sustainable change in the sector. Thank you.
It's my pleasure now to introduce Anne Duggan. Anne is the Chief Executive Officer at the Australian Commission on Safety and Quality in Healthcare and a highly respected gastroenterologist with significant leadership experience in a range of healthcare settings. Anne is also a conjoint professor at the School of Medicine and Public Health at the University of Newcastle, and she's passionate about improving healthcare services through sharing knowledge and collaborating across the health system. It's an imposing resume. Welcome, Anne.
Thank you, Tegan. Welcome everyone to the National Medicine Symposium. This is our first year hosting the National Medicine Symposium. For those of you who may not be familiar with us, the role of the Commission is to work in partnership across the healthcare system to achieve a safe, high quality and sustainable health system. Our key functions include to lead and coordinate national improvements in the safety and quality of healthcare, to support better health outcomes and experiences for all patients and consumers. And of course, we develop national safety and quality standards to support the implementation of evidence-based healthcare. Sustainability is an important national priority and is critical for all sectors, particularly healthcare. We have one of the best healthcare systems in the world. However, the delivery of these services contributes 7% of Australia's total carbon emissions. Taking action on sustainability mitigates the harm of global warming. It benefits the environment in which we live, for example, ensuring that the air we breathe is less polluted. It improves safety and quality of the healthcare we receive, promoting only the care that benefits us, and helps ensure an efficient and effective health system benefiting more Australians. In 2022, the Commission established a Sustainable Environment Advisory Group to support the development of an environmental sustainability and climate resilience healthcare module. This voluntary module will enhance our national safety and quality health services standards by supporting health services to recognise, plan for and mitigate the effects of climate change to ensure the continuity, safety and quality of healthcare and to act to reduce low-value care. As a first step, we engaged the Climate and Health Alliance and Monash Sustainable Development Institute to conduct a review of existing policies and literature to better understand the potential safety and quality implications and solutions facing health services organisations related to climate change and the associated extreme weather events and changing patterns of disease that they bring. This year, we invite people to provide feedback on the draft module and participate in piloting the module prior to its launch in 2024. It's important to note that sustainability is a national priority, and we are working very closely with the Commonwealth on this. There's been a lot of discussion about the areas of healthcare that require our attention and about the tools and mechanisms we can implement to help improve the sustainability of the health system. Things like solar panels and recycled water and electric ambulances. These are extremely important, but will take time to implement. One thing we can do today in our daily activities as clinicians and consumers is to reduce wasteful and low-value care. Low-value care is care that is ineffective, harmful, or confers marginal benefit at disproportionately high cost. Reducing low-value care is especially powerful as it delivers threefold benefit. It delivers better care for individuals, it reduces the burden on the health system, and it helps to minimise carbon-generating activities. We can't improve sustainability without reducing low-value care in the Australian healthcare system. Identifying and reducing low-value care has always been a core focus for the Commission, through initiatives including the Atlas of Clinical Variation and the Clinical Care Standards. And because of that work, we know there is a certain amount of poor quality use of medicines. In fact, as a patient, the thing that is most likely to happen when you interact with our health system is that you'll be given a medicine. Reconsidering how we use medicines will result in more appropriate care for individuals, a more effective and efficient health system. It will also target one of the key contributors to the carbon footprint of the Australian health system and lead to significant improvements in sustainability. Ultimately, one of the most powerful things we can do is to change our behaviour so that we're always asking ourselves, is this the right thing to do? As a GP or non-GP specialist, at times we need to ask whether writing this prescription is really the right thing to do, or is it that we need to have a potentially uncomfortable conversation with a patient? As a consumer, we need to ask whether we really need to run down to the chemist to grab another pill to pop, or should we in fact be thinking about a change of lifestyle? One fewer beer, one more walk with the dog. And as health service providers, we need to ask, are we providing our clinicians and consumers with the tools they need to make the right choices? If we do that, we will make smarter decisions, and smarter decisions will be better for everyone. Thank you all for joining us today. I'm thrilled the Commission is hosting the National Medicine Symposium, and I look forward to the presentations and discussions ahead.
Thanks, Anne. You're really throwing down the gauntlet for us today. What are you hoping people get out of the symposium?
I think one of the great things about our lineup, we've got some fantastic speakers. There's an enormous amount of enthusiasm to do something because there's such a climate emergency. And I'm hoping that we'll connect up people and we'll give people ideas about how to be more effective at actually really taking this challenge on and really driving down inappropriate use of medicines, polypharmacy, for example, and making people think about alternatives and getting that into their day, the way they do business.
Yeah, and so this is sort of, as you said, the first one that you guys are running, and you're the CEO. So why sustainable healthcare as your first gambit?
Well, it clearly is incredibly important, but I was previously the Chief Medical Officer. We did the atlases of healthcare variation. We saw a lot of polypharmacy in the elderly, and we all know that medicines can do great things, but sometimes they're not doing anything at all for us or very little, and there's always a risk of harm. So we really want to make sure, independent of any climate emergency, that we're focusing on making sure that people are getting the medicines they need. But more importantly, when medicines aren't needed, the conversation's happening about the other things you can do. Because really what we don't want to be doing is just focusing on the sick system. We want to be doing health care, not sick care, just alone. So, for example, if you're talking to your GP and your GP notices your weight's been climbing up a bit, having that conversation and knowing as a consumer that if you get your weight back down to where it should be by a bit of walking the dog, as I said, then that saves you being on that trajectory, because we know that, for example, with obesity, that leads to hypertension, high blood pressure, it leads to diabetes, needing knee replacements, all those sorts of things. So I want people to think about their role in actually making sure that there's a real partnership with consumers, and we're talking about what are the things that can keep you healthy.
Right, so not just taking medicines away, but also proactively giving something non-medical, like non-pharmaceutical, to still be doing good. Yeah.
Yes, I think there's a whole lot of Australians who are ageing. You want them to age in the best way they can, and you want them to know what the options are. And really, we've got a fantastic climate. So going for a walk, going for a swim, all those sorts of things, eating all the fresh food that we've got is the way to go.
So you've been a clinician. At the moment, you're a bit too busy with running the commission. But what sort of personal experiences have you had that have really informed your thinking on this?
I think one of the things that stands out in my mind, and it's a thing that occurred when I was a junior doctor. There was a very healthy young man, a sports coach, and he'd cut his arm, and he came into our hospital because he had liver failure. Now, I don't know whether he needed the antibiotic. It was called flucloxacillin. It's a sort of penicillin, but it rarely, just rarely, causes liver failure. And he was this really otherwise fit guy who had a big future ahead of him, and he got liver failure. Now, we live in times where you can get a liver transplant, but the problem was in hospital he got an infection, and that rules that out. So it was a real tragedy. And you think you'd just love to wind back the clock and think, was the right decision made? Was it a clean wound? Did it need something? Could he have just cleaned it up with and put something over it? So that stood out in my mind, that we really must be very careful, always thinking benefits, risks, alternatives, and really having that discussion.
Yeah, those decisions that are made that affect the trajectory of someone's entire life.
Yes.
So why is it so great? Like a symposium like this, we're bringing together people from all over the industry. What's the strength in that?
Oh, we have, if you look across Australia, there are so many people waking up to this issue that we really must be doing stuff. So we've got academics looking at this, we've got service managers, we've got clinicians in different areas of medicine. So it's a great opportunity to bring the brains together, have the discussions, and really injects even more motivation into this, but also some practical ideas and practical ways forward. Absolutely. I'm very keen to see change as a product of this, not just a talk fest, as they say.
Absolutely. Well, let's get into it. It is time for us to hear from Professor Paul Kelly with Safety, Quality and Sustainability in Medicines.
Good morning. And I thank the organisers of today's symposium for the opportunity to address you today about the Australian Government's National Health and Climate Strategy. In particular, I want to focus on how the strategy is likely to encourage the provision of value-based care and low emissions medicines, an outcome that would benefit both people's health and the sustainability of our environment. Before I begin, I would like to acknowledge the traditional owners of the land from where I am recording this message, the Ngunnawal and Ngambri peoples, and pay my respects to elders past, present and emerging. I extend that respect to other Aboriginal and Torres Strait Islander people meeting today. I know there are many people taking part in today's virtual symposium, from healthcare professionals to researchers, policymakers and industry representatives, who are very passionate about ensuring Australia's health sector plays its part in responding to climate change. And as Australia's Chief Medical Officer, I want to thank Australia's health sector for the role you have already played in galvanising action on climate change in this country. This is an issue I have been very passionate about for many years. The time for action on climate change is now, and Australia's health sector has a very important contribution to make in this space. It has now been well over a decade since the Lancet Journal declared climate change to be the biggest global health threat of the 21st century. Since then, Australia has experienced some of the most severe environmental disasters on record. Australians are now living between extremes. Droughts are followed by fires that are followed by recurring floods. The compounding effects of these disasters are taking a heavy toll on the physical and mental health and well-being of our population. Dealing with the impacts of climate change is becoming part of everyday life for many, many Australians. Increasing temperatures are making more parts of the world favourable to the spread of disease through food, water and vectors, while threatening food and water security. Air pollution attributed to climate change exacerbates a variety of respiratory and cardiovascular conditions, including asthma, lung cancer, and ischemic heart disease. Climate change affects health outcomes through its impact on productivity and workforce conditions, housing and other infrastructure, nature and biodiversity, and population displacement. It also contributes to psychological distress and exacerbates mental health conditions and a variety of other adverse mental health outcomes. Responding to these challenges requires a strategic approach to ensure we allocate our resources in the most effective manner to meet this very significant challenge. The Australian Government is working to develop Australia's first national health and climate change strategy. I expect this strategy will be released by the end of 2023. The strategy is expected to establish a plan of action to build a sustainable net zero health system, strengthen the health system to protect the health and well-being of people in Australia from the impacts of climate change, and mobilise whole-of-government climate action for healthy and resilient communities. It will establish a 3-year plan with focus on actions to measure and reduce greenhouse gas emissions from the health system, identify responses to the health impacts of a changing climate, and engage with other sectors on mitigation and adaptation policies that have implications for human health and well-being. The strategy will build on the work already underway across various Commonwealth portfolios, along with the medical colleges and state and territory governments, to transition Australia to net zero emissions by 2050. An extensive consultation process has been undertaken to inform the strategy, including with international counterparts, First Nations leaders, the states and territories, health service providers, aged care providers, civil society groups, academics and industry across the nation. The health sector's ambition to reduce emissions and build resilience clearly emerged across 270 written submissions and during the 16 workshops and roundtables held to inform the strategy's development. One of the key priorities of the strategy will be to support the provision of appropriate and value-based care to improve patient outcomes and environmental sustainability. As Minister Butler has said before, good climate policy is good public health policy, and vice versa. There is growing recognition of opportunities to reduce emissions by increasing our efforts to provide value-based care, avoiding overdiagnosis, overtreatment, and unnecessary clinical investigation. Healthcare is appropriate when it responds to clinical need and is based on the best available evidence. It means offering patients evidence-based interventions that optimise benefits and minimise harm. Appropriate care also reduces waste and can lead to more equitable healthcare delivery by prioritising it to people who need it most. The strategy will highlight the importance of optimising the use of medicines to reduce low-value care. Inappropriate antimicrobial use is an example of low-value care contributing to further unnecessary emissions when antimicrobial resistance increases the need for hospitalisation and treatment. The Australian Commission on Safety and Quality in Healthcare is building on its Australian Atlas of Healthcare Variation to develop guidance on how best to embed appropriate care in corporate and clinical governance. It is anticipated the strategy will strengthen the work undertaken by the Commission to reduce unwarranted care. Medicines are a significant driver of healthcare emissions. The National Health and Climate Change Strategy is expected to outline specific action that we will take to reduce the greenhouse gas emissions resulting from the use of medicines in Australia. The strategy will recognise there are clinically safe alternatives to high-emission medicines and promote a move to using these. It will draw on lessons from international leaders in health system emissions mitigation, such as the work of the NHS in England, which is already well advanced in its work to deliver a net zero health service. Some key medicines that are particularly relevant in this space are anaesthetic gases and respiratory inhalers. Fortunately, there are safe and effective environmentally sustainable alternative inhalers and anaesthetic gases that could be used. One of the areas where the health sector has great potential to reduce its carbon footprint is in the use of two anaesthetic gases in particular, nitrous oxide and desflurane. We have estimated that in 2021, medical nitrous oxide use in Australia produced 300 kilotons of CO2 equivalent. As it stands, a high proportion of nitrous oxide is wasted due to leakage through piping systems, leading to the gas going straight into the atmosphere. The extent to which this is a problem is currently not fully known, but we hope to work with states and territories to find a way to systematically measure and address this leakage. Desflurane has a global warming impact around 2,500 times that of carbon dioxide and 20 times greater than that of sevoflurane, an alternative anaesthetic gas used for similar clinical indications. There is no proven clinical benefit to using desflurane over sevoflurane. It has been estimated that a standard 240 millilitre bottle of desflurane can produce 893 kilograms CO2 equivalent when vaporised. This is equivalent to the emissions consumed by an average Australian household over 2 weeks. Work is already underway to eliminate desflurane use in health services around Australia. For instance, Alfred Health in Melbourne is phasing out desflurane use, and Western Australia Health has eliminated desflurane from its formulary. Respiratory inhalers are prescribed to patients to treat respiratory illnesses, including asthma and chronic obstructive pulmonary disease, and use hydrofluorocarbon propellants. These hydrofluorocarbons also pose significant global warming risks. Use of pressurised metered dose inhalers, particularly relievers, can be reduced by ensuring that respiratory patients are on preventers and switching from metered dose inhalers to dry powder inhalers where it is clinically appropriate. One person can reduce their carbon footprint by 420 kilograms of CO2 equivalent annually by switching from pressured metered dose inhalers to dry powder inhalers. For most people, a switch to dry powder inhalers can assist in reducing emissions without compromising patient care. This would reduce emissions given pressurised metered dose inhalers constitute the bulk of the several million inhalers used annually in Australia right now. A key principle underpinning medical practice is, of course, primum non nocere, or first do no harm. This principle can be extended to our roles as health professionals in addressing climate change. As it stands, approximately 7% of our national carbon emissions are produced by Australia's health systems. Clinical care accounts for 60% of the health sector's emissions, with 40% coming from buildings. Some jurisdictions, medical colleges and peak bodies, amongst others, are already demonstrating leadership in this area and introducing innovations to reduce the carbon footprint of health services. Everyone taking part in today's symposium can play an important role in raising awareness, pursuing innovation, and leading the transformation of the health system to make it sustainable, resilient, and fit for the needs of generations to come. After all, good climate policy is good health policy and vice versa. I thank all of you for your collective action and advocacy to date, and look forward to continuing to work with you to build a sustainable and climate resilient health system in the years to come. Thank you for listening.
Thank you, Paul, for that Australian perspective. Now we're going to look a little bit further overseas. We're going to hear from Professor Nick Watts on the approach to medicines and health system sustainability in the United Kingdom.
Hello, my name's Nick. I'm really sorry I couldn't be there in person. I think you can see I'm in a relatively boring white room down in the depths of some sort of government bureaucracy. Would much rather not be here. I'm going to talk quickly, because I think I've had a look at the agenda and you've got some really exciting speakers coming up. I'm going to talk really briefly about why, about what, and about how. What the hell are we going to do about the climate crisis if we are a healthcare system, if we're a health professional? The why is straightforward. I suspect you're going to hear this again and again, but listen, the core purpose of the NHS, it exists to deliver high quality care now and for future generations. It's been on the front door. It's been on the letterhead for the last 75 years of existence. We're good scientists, we're good healthcare professionals. We know you cannot do that unless you run at this problem, unless you run at climate change. We know that we're expecting a doubling of the number of NHS facilities on high-risk floodplains, a trebling of the duration of fatal heat waves in the country. We know the infrastructure is not ready for that. We know that adaptation, frankly, is expensive, far, far more expensive than tackling the problem head on. The other reason why is we've had about 15 years experience of running at this problem, and every single time, the NHS has tried to tackle climate change, our patients, our staff have loved it. It has saved money for the system. We've been able to reinvest back into patient care. This story has been almost nothing but good news. And the final reason why is when we go out and we ask our workforce, 1.4 million healthcare professionals, 5th largest organization in the world, hey, what do you guys care about? What do you want to see the NHS do more of? The response back is thunderous. 92% of healthcare professionals want to work for an organization that lives up to their own values first, do no harm. They want to see an organization that is tackling climate change. The what is straightforward as well. Listen, the NHS has a net zero target 2045 for our full total emissions profile. There are lots of different targets out there. You can hear about net zero by 2040 something. You can hear about 1.5 or Paris degree compliant, a whole different language worth of things to describe this. I'd encourage you not to worry too much about that and instead focus on making sure that the ambition is right, the pace is right, but that it's right today, right? It doesn't massively matter what happens out in 2044. What matters is what happened at 9 a.m. yesterday, what is going to happen at 9 a.m. tomorrow morning. What matters is getting that time horizon right, focusing on the pace and scale today, not off decades into the future. The why and the what. It's simple. The far more interesting question, if we are going to turn to that 9 a.m. question, is the how. What does this actually look like for a healthcare system? To answer that, you can break it down a whole bunch of ways, but to break it down by the emissions, about 10, 15, 14% of the full emissions profile of the NHS falls into our hospitals, into our clinics, into the energy and the waste and the water that they use. We can tackle quite a lot of that. We have to invest, but the investment has a damn good return on investment. We have put in about £700 million per year into, frankly, pretty simple interventions: energy efficiency, ensuring energy resilience and security for our clinics. Where we invest there, we have noticed a 3.6 year return on investment. This pays for itself like almost nothing else. You have to care, obviously, about the transport, the way that we move our patients around the country, the way we move ourselves, our staff, visitors around the country as well. The NHS has the second largest fleet in the country. That's responsible for about 15, 18% of the emissions profile. Look, those things are important, and we are pretty proud, quietly proud, optimistic that we've had the world's first and the world's second fully zero emission ambulance, and are now starting to purchase those faster than the manufacturers are able to make them for us. All of that stuff is important. But we're here, I think, today to talk more about the clinical side, more about the medicines, more about the medical devices. About 20% of the emissions profile of a healthcare system will be in medicines. About another 20% or so, like plus minus 5, will fall into the medical devices as well. My suspicion is that the healthcare system in Australia looks damn similar to what it looks like in the United Kingdom in terms of its emissions profile. I think probably damn similar in terms of our supply chains as well, to be honest. There we have agency. We have agency over the kinds of drugs we prescribe, over the ways that we prescribe them, what we do with them, who we take them from, the suppliers that we engage with. We are in charge of all sorts of different decisions that have carbon implications out the other side. And so there are questions that we have to ask. The first question is there something better? Is there something our patient would prefer? In the NHS, we've started to really roll out, not a novel concept, but I think novel at this scale, social prescribing as a way of just asking, are we over-medicalizing? Are there better things we could do with our patients, for our patients? Getting them out into culture, into nature, better ways of dealing with some of the chronic disease, chronic illness sort of challenges that the NHS and our patients are facing. the moment and going forward. Often lower carbon, almost always lower carbon, to be honest. There are questions about if we've decided, listen, this is the route we want to go forward with our patient. Are there lower carbon alternatives to those drugs? Often the answer actually is, yeah, there might well be. And a whole bunch of times that we've asked that question, we've gone and done the research and we've found that actually, yeah, there are some better alternatives. They are cost equivalent. They are often cheaper. They are clinically equivalent. They are often clinically superior. Let's be clear, never ever engage in anything that is not putting our patient first. But simply asking that question, we actually find that the answer has a pretty favorable outcome out the other side. You have to do a little bit of work, and we've had to do a little bit of work to figure that out, but it's possible. You will see there, the NHS has started to put a finger on the scale there. We are phasing out some of the highest carbon medicines. If you've been in this space in sort of sustainable medicine, low carbon healthcare for a while, someone will have talked about desflurane, about anesthetic gases. Someone will have talked about mid-dose inhalers. We're sick of talking about it. We're starting to act on it, and we're starting to shift how the NHS is procuring. In fact, when it comes to something like desflurane, we're down to 1% of the full emissions profile of the NHS. There are then questions you have to ask about whether or not there are lower carbon ways to manufacture that drug, whether there are lower carbon ways to get it to us, whether there are lower carbon disposal mechanism, waste mechanisms. That, frankly, it doesn't sound like a clinical question. It's a supplier question. But again, we have agency over that. We have agency over the kinds of suppliers that we engage with. The NHS has been clear. Within the decade, we will no longer purchase from anyone that does not meet or exceed our commitments on net zero. It's a tough target. It's also a little vague, and whenever anyone's vague, you must always ask questions. Let me be a little bit more precise. 1 minute past midnight, April 1st, 2027, the NHS has new procurement criteria. If you want to enter into a financial relationship with the NHS, we want to know that you are heading in the same direction at the same speed as us, that we're working with partners that are also looking out for the best interests of our patients and the best interests of the planet. The response there has actually been pretty positive. Initially, we had a few questions. Interesting. How would you expect us to do X? How will we count Y? How do we know that we're on the right track? We found that as we started to engage and work closer and closer with suppliers, as long as the playing field was relatively even, or as long as the playing field was even, there was an enormous amount of consensus, an enormous amount of support that this was the direction of travel that healthcare was heading. And then finally, we've had to ask questions about the kind of support that we need in that broader ecosystem with our friends at MHRA up in the United Kingdom, the regulator, looking at different kinds of packaging, different kinds of green licensing to start to accelerate that transition towards greener chemistry. Our friends at NICE looking at the kinds of clinical guidance that they can provide to support healthcare professionals, looking to ask questions about what the carbon footprint of some of those drugs are as they move through that licensing process, and indeed starting to build up some of those partnerships between industry and the NHS. One example, a pretty great small business innovation award puts out just small amounts of money that then grow and grow over time as you demonstrate success into lower carbon ways that the NHS can procure PPE, that the NHS can get life-saving drugs across the country. All of those things starting to be important in that transition. But listen, by far the most important thing is the need to make sure that we are all out there asking questions. This transition is going to be big. It's going to be complex. I think it is inevitable. But it's not a question of just one drug, 2 drugs, or 3 drugs. It's not a question of, hey, can we just turn the lights off and then we're more or less done, right? This is about transitioning every single thing that we do in medicine. It's about all of the drugs. It's about all of the medicines, all of the medical devices, every patient pathway, having a serious look at itself and saying, are there better ways that we can do this for our patients? Are there better ways we can do this for the planet? Are there cheaper ways that we can do this? When we get not one question, but 1,000 questions, 10,000 questions, when we get not just one healthcare system, But healthcare systems, honestly, right now in France, in Spain, in Germany, in the United States, in Singapore, in Australia, starting to move in this direction, starting to run in this direction. That's when I start to become sure that this is not just the fun, the possible, the positive future of healthcare. It is the inevitable direction of medicine. Thank you very much for having me. I'm so sorry I couldn't be there, but it looks like you got a pretty great agenda. So enjoy yourselves.
Thank you, Nick. Next up, we have Dr. Elizabeth Devenny with Medicines, Health and Environmental Sustainability, the Consumer Perspective.
Hi everyone. It's a delight to be here with you today for the National Medicine Symposium. Looking forward to hearing from all of the speakers. It looks like such a great program. And let me start mine, and hopefully that's entertaining for you all. So my name's Elizabeth Devenny and I'm the CEO of the Consumers Health Forum of Australia. And today I'll be talking to you about consumers and their perspectives on medicines and sustainability. With the presentation today, really I'm going to talk a little bit first about medicines and the sustainability issues there, and then broaden out a little bit to talk about health, and then a little further and talk about sustainability. And finish with perhaps a couple of calls to action. What are the kinds of things that we might want to do together in order to improve the sustainability of medicines in Australia? So let me go right to it and start with medicines themselves. So we hear consumers tell us stories about going to their local community pharmacy and then coming home and dumping the stuff on the kitchen table. That's often the phrase that's used. Opening up all of the bags, the packets, the bits and the bobs, and discovering there is a lot of waste there, things that will need to be recycled and ideally reused. Australians would like to see less of that waste in the packaging that their medicines come in. And so we're interested to see how that could happen and encourage industry to think about producing things in packaging that is more sustainable. We know that for medicines that are dispensed, many of them are not all taken. So that waste is quite considerable when you think that in some cases we've got wasted packets where the medicine itself is also not used. There was a study recently in the United Kingdom that showed for every £25 that was spent on medicine, at least £1 was unused. And we believe that that will be true, and in fact the numbers might be a little bit higher in Australia. So they've got all of this wasted packaging, and then the medicines inside the packaging themselves may not be used. We know that a lot of healthcare generates waste, and today we're focused on medicines, but I remember during the kind of peak times of the COVID pandemic reading that we were worldwide generating about 2.6 million tonnes of waste per day, and some of that would absolutely be related to the use of medicines. So being very mindful of the fact that healthcare does generate waste that is not necessarily then handled in a sustainable manner is really important for us who are interested in ensuring that health dollars are well spent and that therefore consumers can access services, as many services as they need, because we have the resources to do that. Single-use products also come up with consumers, with many people saying in years gone by they've noticed in healthcare settings that things were recyclable, but now more and more many items are single-use only. Consumers would really like to see some serious attention given to whether or not these items must be single-use, or perhaps we could be using items which are able to be recycled and reused in some way. They're keen to make sure that items that are used for their healthcare don't make a negative impact on the planet and on climate change. So then again, thinking for service providers, for organisations providing healthcare, what policies and procedures they have in place to seriously consider packaging and also consider the use of single-use products, limiting that to only those cases where it's absolutely essential that a single-use package is indeed used. There's an alliance called the Climate and Health Alliance in Australia. Some of you no doubt are active members, and as we are in Consumers Health Forum, if you're not familiar with the alliance, perhaps your organisation would be interested in joining. The work that the Climate and Health Alliance has done has suggested that then 98% of single-use plastics are made of fossil fuels, which we know we should be trying to reduce the use of. And in hospitals alone, a third of general waste is indeed plastic. So we know that recycled plastic is not as high as we might like it in healthcare settings. Again, some things suggesting only 10% of plastics are recycled effectively in hospital environments, and so then they end up in landfill and other places. We want to reduce this impact in how the way that our healthcare resources are used, and so increase the sustainability. How do we make sure that we are in fact effectively recycling the component parts, particularly but not only plastics, and really keeping the waste down in our use of medicines? Quality use of medicine is also a very important part of this agenda. So when I was younger, I remember being taught the 5 rights. So to use medicine to the right person, the right time, the right amount, the right manner. Quality use of medicines means that we're only using what we need, and what we use well. So as consumers, we have the health literacy, the medicines literacy, to understand when to use our medicine and how to use our medicine, so we minimise the waste of that medicine, and that we reduce the chance of an adverse reaction or a poor outcome as the consequence of medicine use. So how do we make sure that every medicine that is prescribed and dispensed, consumers understand the safe way to use that medicine, and so those benefits are reaped and the risks are reduced? Of course, medicine use might also lead into waste. So what do people do when they've got additional medicine? Some of that waste is easier to dispose of than others. So thinking also about potentially toxic or contaminated waste, and the best way for us to manage that, as well as that waste that might be able to be recycled or reused in some way. We know that the production of medicines themselves causes significant waste. The University of Bath did some work on this a while ago, and I think they said something like for every kilogram of medicines we produce 100 kilograms of waste. I'm no expert on manufacturing processes, and I don't want to get into that debate. But given that we know that we will be producing waste when we produce medicines, it's incumbent on us all to think about, does a person need a medicine? Can we be de-prescribing? Is there another way, perhaps that doesn't involve a therapeutic interaction like a medicine, where we can provide someone with a great health outcome? The more of that we can do, the better. So reduction in waste, of course, will lead us more broadly to better environmental outcomes. Now then, to health more broadly, being conscious of our environmental footprint helps us make a difference for health in many different ways. We know that, according to the World Health Organization, between 2030 and 2050, we're expecting about 250,000 people who die each year, additional deaths these are, because of the impact of climate change. That might be from malnutrition, from diarrhoea, heat stress, but things that we can absolutely say these relate to the consequence of climate change. We know the United Nations talks about this and talks about the impact of increased heat on respiratory disease. So we understand there's definitely a link between our healthcare system, the health needs we might have, and climate change. And we know that many aspects of healthcare also require the use of medicines. So if you like, the less healthcare we have to provide, the less use of medicines and the less waste. Some of you will remember quite clearly the fires we had in the summer of 2019 and 2020, where we had significant smoke over large parts of the country. We know for people with asthma, severe asthma, this caused a lot of exacerbations. In fact, we say that about 83% of people with severe asthma noted symptoms during that time. And interestingly and importantly, after the smoke receded, many people experienced poorer outcomes with their asthma. So climate change, bushfires, increased use of a lot of medicines, increased access to healthcare, leading us to consume things at a faster rate, more resource use, and of course more waste. And there was a study just last year published in Nature that found that climate change also aggravates more than 50% of infectious diseases through the increased incidence of things like heat waves, droughts and floods. So thinking about how climate change might lead to poorer health outcomes and higher use of medicines is really important for us. Everything that we can do to reduce or minimise our negative impact on climate is good, and starting small is fine. Do what you can, and that will build to greater impact across the country. Cost of living pressures, which many of us feel right now, also are impacted by climate change. For someone living in a rental home where they have no control about the energy efficiency of the home, where the heater might be expensive or there isn't any cooling, all of these things will impact on someone's health and well-being. The Australian Council of Social Services, ACOS, as many of us know, have reported that people who are least impacted by climate change first, worst and longest, have fewer resources to cope, adapt and recover from climate change. So understanding the unequal impact of climate change on many Australians and the impact on their health makes it all the more important that we try and reduce that climate change and be very mindful of its impact on healthcare. We talk about climate anxiety nowadays too. The Black Dog Institute has been looking at this and said that this is rising, with people reporting very intense emotions around uncertainty, grief, anxiety, loss and hopelessness about the future. And the Institute says that between 20 to 50% of people who live through unpredictable and extreme weather events like the ones we've seen in Australia in the last 5 years, think floods, think bushfires and the like, can in fact develop not only elevated rates of anxiety and depression, but also things like post-traumatic stress disorder and even potentially suicidal ideation. So again, lots of health impacts if we're not looking after the climate, and those health impacts have impacts on the use of medicines, the use of health resources, the waste that's generated and what we have available to share for the healthcare of all Australians. Finally, just a little about sustainability. For us, the key here is really prevention. So I would say, and I'm not the first one to say this, that prevention is better than cure. And I would go further than that and say that prevention is better and cheaper and more sustainable than Medicare. We need to do more to integrate prevention into everyday experience of Australians, into any healthcare services that we provide. So improving prevention, reducing the burden of disease has a lot of benefits for us in maintaining the sustainable use of medicines. We'll be using less medicines, hopefully because people understand prevention and have all preventative strategies in place, they'll have better health outcomes, better life journeys as well. So there are so many benefits in investing in prevention. The Grattan Institute reported this year, in fact, that Australia spends at less than 2% of its healthcare budget on prevention, which is less than many other OECD countries. We know that our national prevention strategy aims to raise this to 5% by 2030. That's not that far away. So really we need to do a better job in prevention. And sustainability also impacts on health equity. So the social determinants of health are so important here. I mentioned earlier that people often experiencing cost of living pressures can have impacts on their health outcomes. We know that people in the lowest socioeconomic areas experience health inequities, chronic disease and the like at much higher rates than those that happen to experience more privilege. And the less resource intensive healthcare we provide, the more sustainable the use of medicines will be. So what do we want to see? We want to see standards implemented to reduce packaging waste in medicines and more careful thought given to single-use items, and really to start to talk about it's not okay to use a single-use item when you don't have to. We want to see improved health equity by focusing on prevention of disease and recognising that changes that we do to improve climate control make a big difference to healthcare as well as many other aspects of our lives. I'd like to acknowledge everyone today who's already doing things to help improve the sustainable use of medicine. Your work's incredibly important. And thank you for taking some time out of your time today to listen to what consumers want to see happen in healthcare. And if you're interested to know more about CHF and the work we're doing, particularly the work we're doing around health and climate change, please consider joining us and following us on our socials and helping us to amplify our messages. Thank you.
Thanks so much, Elizabeth. And then coming back to the practitioner perspective, I have with me Conjoint Associate Professor Carolyn Hullock, emergency physician in Newcastle. Hello, Carolyn.
Hello, Tegan. Thanks for having me.
It feels like there's sort of, on one hand, we need structural change, and on the other hand, we need sort of individuals within the health system to be empowered. Where do you sit within that?
I suppose with my new role as Chief Medical Officer, I actually span the spectrum, and in some ways I see my job as connecting the different groups and what can clinicians do, what can the system do, and then how does it fit in a national perspective? So interesting.
As a physician yourself,
Yeah.
how have you sort of taken the reins in your own practice?
So over my career I've been director of emergency departments, and I think one of the things that's interesting about emergency medicine as opposed to other specialties is we don't see all the patients who come to the ED, and we actually have to manage the whole system. So, 40,000 patients a year you're responsible for, even though you're not there on the floor all the time. So I think as emergency physicians, we actually do think a lot about the system. So how can we make sure that the person arrives at 2 o'clock in the morning with chest pain is going to get the right care for their heart attack, as opposed to if I was there myself. And I think in order to have a system that's orderly, we need to understand the data, and we also need to understand all the and have systems in place so everyone knows what's expected of them.
Yeah, so like gathering data, having knowledge of a whole system, actually being a practitioner yourself, is there a way that you've found that works to kind of balance all of these, feels like a lot of spinning plates?
Yeah, there are a lot of spinning plates, but that's life, isn't it? I think the last time you and I spoke was about sepsis, actually. And if you think about it, you can't expect the system to be able to react immediately if you haven't actually got the system in place. So for sepsis, it's knowing these are the red flags, this is what we have to know about. This person needs to go to the resuscitation bay. If we go to the resuscitation bay, this nurse knows how to draw up the medicines, this doctor knows what to do. So it is actually a lot about the system, I think. And I suppose I've been able to take that knowledge and understanding of the system at a micro level and being able to take it to a national level. And that's how it kind of fits with sustainability, really.
Yeah, and those systems have to be underpinned by evidence, which needs to be gathered and synthesised.
Yeah, so one of the great things about working at the Commission is that it's very evidence-based and it is very collaborative. And when we develop a clinical care standard, we bring together experts that's multidisciplinary across the whole country with different national, rural, metro perspectives. We have literature reviews, and then we kind of bring it all together into a document that means that wherever a person goes, they should get the care that they can expect.
So in terms of standards, what kind of standards do you think we could create or apply so that health professionals are adapting their practice to be specifically environmentally sustainable?
So the Commission's specifically working on a sustainability module at the moment for national standards, and I think their perspective on what the health system should do. But as clinicians, in some ways, it's the clinical care standards are more relevant. So we actually have 17 clinical care standards now. And they're all the high-risk, important conditions that have been, there's a whole process for identifying them. But each of them touches on medicines across the way, and then touches on sustainability in some ways, as I said with sepsis, so that we're using the right medicines at the right time for the right patients and delivering the right care.
Are there sort of simple measures that could be implemented in places within hospitals, like the pharmacy, to make those practices more sustainable?
Well, in the national standards already for pharmacy, there's actions in the medicines module that number 4, testing me, but it talks about how do we use medicines, how do we store them, how do we like curate them, steward them? How do we dispose of them? So I think those things are already in the system at the moment. The national standards, there's two main standards for me. One's around governance, which is how does the system work and how accountable we are to the system, and then how do we partner with consumers. So they kind of underpin all the other standards. And then if you've got those two things right, then the medicines part should work.
So coming back to the individual level, what advice do you have to sort of delegates who want to influence the decision makers in their organisation to have more sustainable practices?
I think data is powerful, and I think we belong to a system that's mostly electronic in many hospitals now, and as clinicians we're required to put a lot of data in, and I actually feel like we also need to have an accountability and an ability to pull the data out. And think so. As I talked about initially about chest pain's the number 2 presentation to emergency departments across the country. So, how many patients come to your ED? What time of the day do they come? What drugs are they being given? And if you start to delve into that information, you can actually really understand what the problems are and what the issues are and where the gaps are that you need to address.
Thanks so much, Carolyn, for sharing that knowledge.
Thank you.
And we're about to take a brief break, but don't go too far, because when we come back, we're going to be delving into much more detail into the appropriate use of medicines in practice. See you in a tick.